Hey everyone, Happy New Year, Happy 2018. It's actually January 18th today, so it's not exactly new, but I want to wish you all a Happy New Year. I'm not into the hoopla of New Year's, but what I am into is being better year after year. Being better year after year, and going from 2017 into 2018, that's what I want for you as well, and I hope you do. Today's video, I'm going to talk about three things. Number one, New Year's resolutions and why I didn't set any versus just being better. Number two, asking the question to yourself, what it is that you really want this year. What do you want out of the year of 2018? And number three, I want to share with you new and exciting things that are going on here at DiLollo Chiropractic, some courses that I've taken, some analysis and styles or techniques, if you will, that we're incorporating in the office. So number one, New Year's resolutions. Why didn't I do a New Year's resolution? If you have and you've set them and you're doing well with them, keep going, rock on, keep doing it. If it's around the second or third week of January now and you're kind of falling off of the New Year's resolutions and maybe you're not hitting that mark, don't get depressed, don't get down on yourself, just back up and regroup. That's one of the reasons why I didn't. Not because I don't want to fail or whatever, that's not even it. But you know, when you don't hit the mark for your resolution, it kind of makes you feel bad. So that's one of the reasons why I wouldn't want you to do that if you are the same as me when that comes to New Year's resolutions. I like the concept and the idea of just being better. Just be better. Just be better than you were yesterday. Be better than you were the week before, the month before, and be better than you were last year. Reflect on 2017. See what worked. See what didn't. Embellish what worked. Remove what didn't, and just be better. Just be a better you. You can't accomplish anything. Don't get me wrong. It's not that I don't have goals. I have goals for 2018. There's things that, of course, you want to achieve for my family and myself and my practice and my business and my extended family as well. So I'm not saying that I don't set goals and want to achieve things. I would suggest you do the same thing, but I'm just saying, even when you reach the goal or you reach the New Year's resolution, whatever it is, the window of happiness about it is kind of small. You're happy and you're glad. You're always going on to that next thing, and that's how human beings' brains work. We're always kind of going on to that next thing. Now, okay, so I lost the weight. I've got down to my ideal body weight. Now, what do I want to do? Well, maybe now you want to run a marathon. I don't know, or you want to. Go on that vacation that you were waiting for, or you want to, get into a bathing suit because you feel like you look better. Whatever it is, it's all good. So, New Year's resolution versus just being better. Just be better. Be better than you were last year. Number two, what is it that you really want from this year? What do you want out of 2018? Do you want to make better? Do you want to be better at your spirituality? I don't know. Maybe you want to get connected to your creator even better and even more than you were last year. If that's not your thing, maybe you do want your physical body to be better. Maybe you want to fit into clothes differently, what have you. Maybe you want your relationships to go better than they did last year. Maybe you want your finances to be better than they were last year. Maybe you want to improve upon your emotional state. Right? Maybe you just want to be better with your emotions or better with your mental state, your self-talk, your auto-suggestion, the things that you say to yourself. You want to be better at that. Get books, read, do whatever it takes to be better at that. You are worth it. You are worth it. Just be better and figure out what it is that you really want. Do you want to take a vacation? I don't care what it is. It's for you. It's whatever you want. But once you decide that, go for it. Go get it. Go get it. And I don't know about you, but there's no way in the world that you can accomplish those things and be better in the new year, any year, 2018 and beyond, if you don't feel good. If you don't feel good and if you're not, and your body's not working right, it sucks going through life. And if you have an ache or pain, you can't get out of your car because you don't, those types of things. You can't, look at a computer screen too long because you have aches and pains. You forget about reaching goals if you can't even do that. So none of that gets accomplished without you and without you feeling good in order for you to be better. The third thing is the new and exciting things that are going on here at the office. I want to share them with you. We're excited about it going into 2018. I've been kind of doing a new method. We call it the DiLollo method for right now. It's been going on for about 4 months, so we're really excited about that. More on that in just a moment. But some of the things that are a little bit the same, Maria's here. Maria's still here with us at the office. She's doing an awesome job. This, I think, coming June will be 2 years that she's with us, so she's here about 1.5 years. We're excited about that. Margaret came on board. Yeah, Margaret's over there. You can say hello, Margaret. Margaret came on board in November. She's also doing an awesome job. I feel like I've got a fantastic team. I appreciate them, and I appreciate everything they do for the practice. And so looking forward for that this year. Back to the DiLollo method. So I'm on a constant pursuit to learn, right? You never stop learning. Even one day, maybe when I transition out of actively taking care of patients, I think I will be a forever learner. You always want to learn more. And quite frankly, I won't share the story with you about how I came across this approach that I'm doing now, in addition to what I've been already doing to kind of blend it and make it my own method. It kind of happened serendipitously. I feel like I was kind of led to it. I don't want to get too weird on you, but I think I was, and it's working out famously. But I'm always looking to take the level of service and the level of healing with my patients, for my patients, and to my patients to be better and better and better. And I think I'll forever be on a pursuit for that. I don't think that will ever end. So this year is no different than, the end of last year going into this year is no different for me. Those of you who are patients already, you know that I'm an Activator practitioner. I use that instrument called the Activator. I'm an instructor for Activator, right? So I'm a teacher. I teach on the East Coast here to the doctors in the area that want to do Activator methods. That is my primary technique. But I've also added another technique and blended it together. The other thing about the Activator technique I want you to know that is new as well. I was trained in chiropractic. I was trained in, traditional, if you will, chiropractic. And I practiced that way for a good 6 years until 1999 when I went into instrument adjusting and went to Activator and did some other instruments, but primarily Activator. And now, as I said, I primarily do Activator. But I also and I've been incorporating more and more as of late, the manual style adjustment. So those of you who are out there that want that style of adjustment and maybe didn't come to us because we did Activator exclusively, I just want to let you know that that's what we do. We will do that, and we're not going to do it with everybody, but whoever can tolerate and who wants that, it's working well with our new methodology and our new analysis as well. But the Activator is also being utilized, as I said, primarily with the adjustments, and it blends really nicely with the analysis. I'm going to take you over to the wall over here. I just want to share with you a little bit more about the technique that we are so excited about, because we think it's awesome. The feedback that I've been getting, my wire's here. This is all impromptu. This is nothing scripted, folks. This is just, this is how we roll here. So excuse my wire there and all right. So I just wanted to make sure we have good audio. So let me just teach you something real quick, okay? So there's 6 major systems in the body, and each one of those systems has a center in the brain that governs that system, all right? So 1, 2, 3, 4, 5, 6. Those are the charts that I use to explain these systems. The number 1 system is the glandular system, right? You've got 2 glands in your head, your pineal gland and your pituitary gland inside your brain, inside your head. You've got glands in your throat. When you get a sore throat and you get swollen glands in your throat, you've got glands there. You've got your thyroid gland. You've heard of thyroid conditions. There's a lot of that going on right now. And what's cool about this analysis is people are starting to know that they can, in fact, come to me, yes, a chiropractor, for thyroid-related problems, which you might not think. I know, but it's true, because it's how the body works, and it's basically just simple anatomy. So you've got your thyroid gland as well, you've got your mammillary glands, you've got your adrenal glands, and you've got glands down in your stomach. And some of the things that are related with the glandular system is the kidneys, then the pelvis, and your concentration levels, and your relaxation, your memory, your appetite, your energy, your skin, your reproductive organs, your hair, your stomach, your thyroid gland, your adrenals, as I said, your temper, your digestion, your sleep patterns and your sleep habits, your elimination as well. All right, zone 2. Zone 2 is the eliminative zone. The eliminative zone is anything and everything to do with your body that eliminates toxins from your body. Like your sinuses, your lungs, your kidneys, your ureters, your bladder, your intestines, your skin, and your liver. Your liver is a detoxifier. And some of the things related with the eliminative system is obviously your colon and your bowel movements and your abdomen and your sinuses and your mucus level and your nasal passages, your throat, your nose, your bronchial tubes, your lungs, toxins themselves, your kidneys, your elimination, and your small intestines. The number 3 zone is actually the nervous system zone. That's zone 3. So there's a center in the brain that governs the nervous system and helps the nervous system do what it's intended to do. And let's face it, your nervous system controls your whole body. So your sleep is also involved with that. Obviously your nerves, your ears, your nervous system itself, your eyes, your sense organs, any of your sense organs are involved with that. Your solar plexus, right? That's for your breathing, your diaphragm, etc. And your digestion, your relaxation, your reproductive organs, your appetite, and your elimination, all related to zone 3. Now, the 4th zone is the digestive zone. When I say digestion, most people think about just going to the bathroom, but it's not only about that. It's about how you're digesting your food, how you're assimilating your food. In fact, assimilation is one of them. Stimulation of the digestive tract is another one, whether that's happening or not. Some people are constipated, let's face it. Some people go too much. Some people have acid reflux or indigestion. It's those types of things. When I tell you those things clear up relatively quickly when we do the proper analysis and check to see which one of the systems is out of balance, it's remarkable. So that's zone 4. Zone 5 is the muscular zone. All your muscles, basically. All right, and what has to do with that is, again, there's a center in your brain that governs that particular system in your body, and your head is involved in relaxation and your movement and your muscles, your neck region, your arms, your hands, normal feeling throughout the body, nerve energy throughout the body, your chest, your abdomen, your back, your spine, normal tone and strength in the muscles, as well as the suppleness, pelvic region, legs and feet, and walking. In addition to, if I didn't say already, the muscles in your head. Zone 6 is the circulatory zone. So zone 5 has to do a lot with injuries, etc. So zone 5 has to do with, system number 5 has to do with muscles, bones, tendons, and ligaments, and or your center of gravity. Works wonderfully if that zone shows up and a person comes in and they're having vertigo or some form of dizziness. I'm not kidding you. Like a charm. It's unbelievable. My own father-in-law was just having a bout with that in an episode, and we cleared it up in, I don't know, maybe a week or two, something like that. Zone 6 is the circulatory zone. Anything and everything to do with your circulation. So yes, your blood flow, your lymph flow. Yes, it has to do with blood pressure and your heart and your sense of ease and your strength and your blood vessels and, again, your back, your legs and your feet, your chest, your abdomen, the overall circulation, the lymph vessels and the lymph circulation itself, right? Lymph carries your toxins out of your body, and if that's not draining properly, then you back up and lo and behold, you usually get ill. Ease of movement, your arms and your hands, head and neck, relaxation, and your thyroid glandular is involved with that as well. So I've had some positive feedback with people and their blood pressures normalizing. Yes, reducing and coming down. In fact, sometimes even too low because they haven't regulated their medication that they were on, and some of them are actually looking forward to getting off the medication, which they never thought was possible. Interesting stuff. And I don't care what anybody says. I don't care if any other physician, any other doctor on the planet says that I, as a chiropractor, should not be speaking about that. That's fine, but all I can tell you is the results. That's all I care about, is the results. And if that's the result that's happening with that patient, and they've not done anything else except come here and get what we're calling the DiLollo method, and they're allowing us to use our methodology on them to get them well, that's all I care about. That's the bottom line, is the result. So the other check that spine out over there, right? That's cool. It's a stainless steel spine. That spine right there and these charts over here have to do with one another, because that particular that particular spine, and doctor basically invented both of them. Dr. Fleet is his name. Awesome guy, very way ahead of his time. So the way that the analysis is done is very simple. There's points on the back of your head that I touch, and they will have a certain feel and a certain tenderness to you and a certain touch and feel to me as the practitioner that allow me to analyze which one of these systems is out of balance. And when we put the systems back in balance, the body heals and the body regulates itself. So if you want, I'd love if you're a patient and you haven't been here for a while, and you're having something going on with your body and you're just not getting the result, or you just haven't seen us for a while just because you feel real good and you're curious as to what zone might be off for you and how you can be better this year in 2018 as a result of getting your systems balanced, I'm going to attach a gift card or a gift certificate or something to this video. There'll be a link of some sort to click on for, just to come in for a session, a complimentary session, to have you experience our method and how I'm blending the techniques and the styles that I've gained over the last 25 years to perform this DiLollo method. All right? Until next time, I'm Dr. Frank. Happy New Year, everybody.